Welcome back, guys, to the True Sports Physical Therapy Podcast. Today's guest is Colby Wartman. Colby owns Origin Performance out in North Dakota. He is doing unbelievable stuff with sprint mechanics. That's what we dive into during today's conversation. I learned a tremendous amount. I know you will too, so share this with all of your sports PT friends, all of your strength coaches, because he's going to make you better at what you do, and that's what we strive to do here. Colby graduated from Dickinson State. He got his bachelor's in exercise science and phys ed, and then he got his master's degree. He got an MBA. So the guy knows how to teach sprint mechanics and also run a business, and that is really clear. Check him out at Origin Performance. Guys, thanks so much for downloading this. I look forward to your feedback. Enjoy. Welcome back to the True Sports Physical Therapy Podcast. Excited to have Colby Wartman with us from Origin Performance. I found you just kind of looking through how to be a better speed coach. And I think that's what I want to get into today is bring a little bit of that speed knowledge to the sports physical therapy world, see how we can blend them. We go through as sports PTs, we go through an education that's really wide ranging. We do everything from burn care and EKGs, which I almost failed when I was in graduate school, to sports PT and therapeutic exercise. And unfortunately, I think we get too little of each kind of sides of the spectrum. So we come out knowing a ton, but really a master of none. I want to dig into your world, Colby, as it pertains to coaching speed. So tell me what the first thing you assess when evaluating an athlete's speed.
Yeah. So thank you for having me. It's awesome that you found me in that manner. That's what we're trying to do. So that's a good thing. The major thing.
I mean, you're in North Dakota. It's so easy to find guys in North Dakota.
Exactly. The metropolis. So the major things is I have a traditional physical therapy background just from the internships that I did younger in my career. And then going into the strength side, which was my cup of tea, going through undergraduate and my master program, and then really adapting into the speed side as I saw the industry start to shift. And so there's a blend of all three of those. So the first thing that we do, we go through a traditional movement assessment. There's some FMS blending in there, you could say, but we're going overhead squats, Faber tests, ankle range of motion, and a couple other things there. After that, we go through a movement demonstration for all of our primal movements. So we're going to hit squat, step, lunge, vertical push, vertical pull, horizontal push, horizontal pull. And from those deficiencies is where we start making educated changes from there. And then getting into the sprinting side, so it's kind of the three-headed dragon, we go through 4 assessments that we have dictated for our opinion that make up athleticism. And that is max velocity, acceleration, power output through a vertical jump, and then a change in direction test. And if I can look at that from a holistic approach and see the deficiencies, I really believe, and we have the data to back it, that we can really ramp up their performance from that. So those are the first things that we're looking for.
As far as a basis of deficiency, we're really looking at a lot of things.
Whether it's how the foot lands, are we getting enough flexion in the hip, big things like that are going to move the needle in the right direction with very small coaching.
Okay, so I love that. I just love that you're assessing, and it sounds like objectively assessing. I think that's one thing that we struggle with is what exactly are we measuring? And then I think we know how to change once we get that measurement, but what exactly are we measuring? So you kind of answered that. Give me a little more specifics, though, on that, because when you say FMS, my head goes to like their scoring system of like 0 to 3 or 0 to 4, some crap like that. And I find it to be very subjective in nature. So give me how you're actually measuring ankle dorsiflexion, how you're measuring like that hip angle that you spoke about, and how you're measuring overhead squat.
Yes. So we have drove a ton of results from video work, because I can really tell a kid, hey, you're shifting this way, this right ankle's tight, which is causing valgus and X, Y, and Z, the whole thing. But as soon as they can see it, I can tell them, and they just don't click. Because I probably should have got to this prior, but most of my population is college, high school, with some professionals sprinkled in there. So once they have that body awareness to know, like, hey, this is what's happening, I need to change that, that's a big thing. So we drive a lot of the change and measurements from the video. So we use 2 apps, OnForm and another one that is more on the sprinting side, to measure angles, whether it's our ankle range of motion test or where we're at with a side shot with our overhead squat. Now, in the overhead squat, I'm looking for very simple, but very glaring things. Okay. Can we hold a posture and position overhead while squatting, or are we diving forward? Do we not have the scapular contraction and control? In our range of motion test for our ankles, are we able to get our knee to the wall when we're very, very close, or do we have to shift it? And then when we're doing our sprint assessments, we will actually use on form, and we can actually put all the angles of their body, and we're looking at making sure that, hey, if you're not getting flexion at your hip, more than likely it's one of two things. Your hamstrings are ungodly tight, your hip flexors are ungodly weak. And so we really just look at video is the big thing for me.
And all of that is markerless?
Yes.
Okay, that's super cool. And it's spitting out their exact angles of hip flexion, hip extension, and dorsiflexion, et cetera. And then you work from there.
Yep. And then we actually throw it up right on the TV here. So we run a small group model. So if there's more than 5 athletes, we have 2 coaches. And we have that thrown up there so the kids can see. They can also learn from their friends. And with those markerless systems, a caveat is you have to be meticulous with your angles of capturing the video, right? Like that has to be constant. So we've made sure that that is constant so that we can see not only a front view, but also a side shot so that we can stay with them and get very close to correct angles.
Okay, so okay, that's a really important note. So working from ground up, ankle dorsiflexion, they're missing ankle dorsiflexion. You said you do that knee to wall test, right? First of all, give me the parameters of that knee to wall test. What is bad? What's good? What's in the middle?
Yep. So how we do it, just with the volume of kids, my first 9 years of coaching, well, 8 years, I did 90% one-on-one. So then I could get really granular with it. Now we're in a small group model, so it's more get the kids in, get the highlights, right? So what we do is the general thumb test is we do a thumb and a fist away from the wall. So your toe needs to be a thumb and a fist away from the wall. And generally, if we can get our knee to or over the toe without lifting our heel, it's usually sufficient for 2 things, squatting and sprinting. If we have a deficiency in that, that's where we'll start to see the twisting of the hips, the valgus knees, the collapsing of the arches.
Okay, and then so if they're missing that, what's your corrective? How do you get them to improve that?
So the big thing that we find is there's either a calf tightness, number one, or some type of impingement in the front of the ankle. If there's an impingement, it's a little bit more difficult for us, and that's where the physical therapy world, where we can learn a lot more from them. But we do a banded ankle mobilization. So we put band super low below the talus, make sure that it's pulling back in a perfect perpendicular angle, and allowing them to open up that joint and drive that knee forward. If it's a calf tightness, which for me, that is a thing, we'll go through probably 4 or 5 different calf things that we can do, whether it's ankle pedaling or wall drives, that will help loosen up both muscles of the calf.
Okay, and how quickly does that stuff work? I assume you're putting them back into that test to measure whether it was effective. How quickly do you see results there?
If their consistency outside of the gym is great, we can see big improvements in 2 to 3 weeks. But if it's just coming in twice a week and just doing it with us twice a week, you know how that goes. It's a month and a half, right? When we really see some changes. The big things that I'll see is the changes in their sprint mechanics. Can they keep the ankle stiffness is a big thing, and can they really hold the posture that we want with the ankle as they're going? And in my world, Yoni, it's the biggest problem is, yes, there's super bound up ankles, but the biggest problem is ankle stiffness, number one, and arch stiffness. You'll see a lot in high school and even college kids that wear basketball shoes, insoles, like their arches are so weak. That's our biggest issue, for sure.
Okay, and do you measure that? I think that's a tough thing to do.
It's super hard. We've never had a metric to measure it. The main thing is as we do video analysis. So I take a page out of Tony Holler's book, one of a very simplistic sprint coach. Take a page out of his. Everything is ranked, recorded, and published. So every sprint that we do is timed. Every sprint that we do is videoed. That allows me to see some changes in ankle and arch stiffness. But that's like all I can do, really.
Yeah. But that's super interesting. Then when you say, it depends how much they're doing their stuff at home, how are you prescribing what they should be doing at home, and why do you prescribe it like that?
Yeah. The biggest thing is if we have a massive deficiency that is impeding their performance, like I want them to be doing 1 to 3 sets of whatever the protocol is every single day, right? And most of it is super low intensity stuff like toe grabs. Grab a towel, get those toe grabs, and really working on the arch, or some type of ankle mobilization that isn't intense at all. It's just getting motion. So usually if we can bite it in the butt on the front end, we'll see that performance really increase through our metrics. And then we look at if there's any other deficiencies. That's the big thing that I think I've improved at as a coach going through my journey is I used to, hey, here's your corrective work. Fix it. If it's fixed, just keep doing, or just skip it, right? There's always deficiencies that we can see. It's just how much I want to dive into it, you know?
Yeah.
So that's the big thing.
Yeah, I think that makes a lot of sense. I like the way you approach that, giving them their homework, but also being able to measure how effective it is, and just test and retest, test, intervention, retest. I think that goes a really long way. What are some speed interventions or coaching cues that you think are overrated?
So a lot of this comes from like maybe my experience as an athlete as well. I was a college athlete, all conference, Division II NAI level, and it was bigger, faster, stronger. There was no sprinting. It was kind of bad. So the main things that I see is people really, really over cueing an athlete. That's the big thing. Now, sprinting and cueing sprinting is probably the most difficult thing and there is, because they're running away from you and your eye can only catch so much. So that's why we use a lot of slow-mo camera stuff. But I would say the over cueing of it, the thing that I found in the simplicity of it, I feel like over the years, we first started doing sprint training about 3.5, 4 years ago. It was trying to be so meticulous and breaking down everything. And these kids were just slow because they were thinking
overloaded. Yeah.
So now it's like every rep, and I have a couple athletes in here doing some recovery. They know how it goes. Every rep, we're trying to fix one thing and just solely focus on that one thing. And then we move on. That's the big thing for me. So over cueing with undereducated and experienced coaches, which I was there. That's the big thing that's really stuck out to me.
Yeah, I think you bring up a good point. The experience of the coach, but also the experience of the athlete, like understanding where you're at, what their training age is, how much they're able to ingest and then apply. I think that's really important. So everyone listening, like when you get a patient in, you get an athlete in, they're coming back from a given injury. It's about understanding, being able to read the room and know how long has this athlete been working on stuff. How much are they able to actually take in and make changes? I think that's a good point. It's also when you're cueing sprint mechanics, one of the things you mentioned that's hard is they're running away from you. Another thing is they're moving as fast as they can, ideally. So how do you make changes at these high levels of speed? I think it's worth thinking about. So your use of slow-mo camera goes a long way, and everyone has access to this now that we have phones in our pockets, that you're just able to slow things down and show the athlete where they should be and what they're actually doing, and then let them solve the problem as opposed to you trying to solve the problem. That's something that I swung and missed a ton in my career, and trying to learn from that. When you describe good sprint mechanics, what is that? What is the ideal way to sprint? Because if we don't have that, how do we know how to push someone along, right? We don't know where we're shooting. So what is good sprint mechanics?
First off, what I'll do is give very good examples. And the best example right now, he's probably top 5 in the collegiate side, but Keenan Walker. He's out of Iowa, very fast white boy that just gets it, man. Everything is super sound. When sprint coaches want an example, they go to Walker. So if we want to look at like this pedestal of sprint performance, a couple high level things that I focus on for high school and collegiate athletes. We have to have hip flexion. And the biggest thing, hip flexion, and I think you'll find this interesting because it's very similar to PT. Sprinting is just a game of inches. And how I break it down is there's what's called a break step and an acceleration step. And that's one thing that I feel like as soon as kids get it, it just changes their performance. So one of my sprint coaches, one of my strength coaches that was my mentor going through my undergrad and master's, Coach Pete Leno. And Coach Pete Leno was one of the pioneers on the Athletic Republic treadmills back in the day. And man, it was a cool deal. Well, his biggest thing is him and his mentor actually went down to Russia and looked at what Russia was doing, and went down, looked at the manual, tried to build Athletic Republic off of that. And the big thing that they found, obviously copious amount of drugs and all that stuff.
That'll help.
Yes. The best way to get faster is to stop slowing down. And that is the basis between brake steps and acceleration steps. So anything that lands anywhere from 1 inch to 1 foot in front of the hip, in front of your center of mass, that is a braking mechanism that is slowing you down. And as soon as you get that foot underneath your hip and start pulling the earth back for you to go forward, that is where you're going to start accelerating. So the best example is if you ever watch motocross, when these big jumps come, they scrub off the jumps to stay as low to the ground as possible, because they want that wheel hitting the ground and pushing them forward. So when we teach our the standard of sprint mechanics, it's enough hip flexion so that your foot can land under your center of mass. When you have that, it just clicks, because then if you land out in front, it's a braking mechanism. If you land underneath, you're really peeling the ground back. That's the end all be all. And there's really high level sprinters and NFL athletes that can't do that. So this last year, when I went down to San Diego, we had Tony Malott from Montana. He's at the Raiders now. Bunch of these big names that Dylan Gabriel out of Oregon. We had a draft class, and even some of those guys can't do that. So it's a big deal. But hip flexion into very correct ground contact.
Okay, so how much hip flexion is necessary? How do you measure that?
So we measure it by where the foot lands. Okay, so I don't necessarily measure it per athlete. We just measure it where it should be for each athlete. So we don't measure the exact angle of it. What we do is if our hip flexion is an inch short, this is usually what happens from a very simplistic 10,000 foot view. If our hip flexion is an inch short of where it needs to be, your foot will usually land anywhere from 8 to 12, 1 inch out in front of you. So it's all a game of inches. If we're an inch short, your foot lands an inch out in front of you. 2 inches short, 2 inches out in front of you. Because with our forward propulsion, our knee has to snap up and snap down, and it's all timing. So once they get that, that's where it's huge. And you can see right away, like we talked about, the biggest deficiency is hamstring strength or tightness and hip flexor strength.
Okay, so how are you measuring those to differentiate between the two? Mm-hmm. How are you measuring? Let's start with hamstring strength.
Yep. So the biggest thing right away. So we'll do a couple of our tests here. Sometimes in the Faber test, you'll get a little bit of groin inside hamstring tightness, but we're just doing a regular, what do they call them? It's like a partner stretching protocol, and getting them up to a sufficient level where I feel like they can touch their toes in a hinge. You guys can get to almost parallel in our hamstring stretch. Now, I would rather have athletes tighter than looser. But
now, hold on, is that hamstring range or strength?
Range. We're testing that. Did I say strength at the start?
Well, yeah. Just tell me, like, what's the common deficiency that is preventing them from striking the ground underneath them? Is it hamstring range, or is it hamstring strength?
Range. Yep.
Range. Okay. So that makes a lot of sense. So now what you're saying is we're going to restore the range by what you just described. So partner stretching, I assume that's like some type of PNF, like contract relax stretching. Then your goal is for their ability to touch their toes without excessive, I guess, spinal flexion. And that becomes like a piece of their homework. And that's going to correlate to what? That if their hamstrings are tight, they're not going to get enough hip flexion.
Yep, exactly. What happens, and I won't mess up the camera angle, but what happens when that hamstring is too tight, what we'll get is instead of a knee punch, we're going to get a heel kick to a knee punch, which causes my foot to land out in front of me.
Gotcha.
Does that make sense? So when that hamstring's tight, it wants to be relaxed. So it's going to kick the butt. We're going to shove that knee forward, and then it's going to land way out in front of us. And that's where you see a lot of collapsed arches and break steps.
Okay, that makes sense. It also supports the use of A skips and teaching A skips properly because you're teaching that hamstring to move through its range with the sequencing that you want. So I think that's another point that's worth just calling out is when you're giving your patient these warm-ups, it's not just, hey, I see a lot of athletes doing A skips, good way to get your heart rate up, but you're hopefully addressing some of these deficiencies. So that speaks to the need for proper hamstring length. Talk to me about hip flexors. I think you said that's commonly a weak point, a strength issue.
Yep. That is a strength issue usually.
Yeah.
As you know, sometimes when it is a range issue, we're getting a lot of lower back tightness and issues there. But as far as a strength issue, you'll see it in sprints almost right away. And this is where that foot is just, instead of pulling, it's actually striking forward when it lands, because they're pushing and they just can't get the flexion they need. Couple ways that we strengthen them is through a lot of our patterning, right? Our A skip, B skip.
So hold on, before you give me that patterning, just so I make sure that I'm on the same page as you, their hip flexor isn't strong enough, so they're not getting enough knee drive, and so their foot's coming down early, and therefore their foot is coming down early. It's going to be in front of them, as opposed to clearing the range up towards flexion and then being able to strike down and back, and that's because of a weakness of hip flexors. Does that make sense?
You have it perfect. Yep.
Okay.
Yep.
All right. So now how do we get it stronger?
Yeah. So we, a lot of times, as you know, in my world or even athletic training world is where you see it. Athlete comes in, hey, my hip flexor's tight. Oh, let's just stretch it. As we know, the muscle that is tight is usually weak. So we do a strengthening and then stretching protocol that I use. It's not perfect, but it works. So the patterning is the big thing. If we can do it at a 50% intensity of what their sprint is, they can start patterning that over time. The big thing for me is just having intention behind their prep. So we quit calling it warm up. We just call it sprint prep. It's a small psychological change that I think helps. So those kids are going to be doing A skip, B skip, those kind of things. But then we do a lot of tuck jumps, a lot of switches, and a lot of like ankle dribbling. Those all help a lot. And then they lower the intensity so the learning happens and then they can apply it is the big thing.
Yeah. You're reminding me of an athlete that now he plays in the big leagues. I was working with him when he was in the minors and then eventually to the big leagues. I gave him like a switch jump, like a lunge switch jump. So just jumping in the air, being able to quickly switch and then switch back. The guy could not figure it out. And this is a 230-pound ox. And he just couldn't understand why his old-ass physical therapist could do it, and he couldn't. So much of it was he had never trained hip flexor strengthening, let alone rapid hip flexor movements and shortening and elongation. So, like, including that, that's why I love hearing you talk about switches, tuck jumps. Is there any and I love that you're doing it like this because it mimics the sequencing of sprint mechanics. Is there any isolated hip flexor strengthening that you go into where you load them or you do like pulls or anything like that?
Yep. It's hilarious that you talked about lunge switch jumps. We just did them this morning. It's on the board. So we were doing, I call them ninja jumps when we do a double switch. So you're starting left foot, switch, and then land like that. You'll make kids look like baby giraffes sometimes when they do it. Yes, there's some isolation stuff that we use. I use what's called kettlebell knee up, toe up. So we'll take off our shoe, go into really hard dorsiflexion and make it stiff. And then we'll do almost like a step up series where they're driving their knee up, getting tall arm swing, make sure they're stiff, and then go back down slow on the eccentric so they can really control it. And then there is some banded work that we do. So we'll put a band right at knee level for each athlete. They're grabbing on way deep into the rack. And then we're working on both the hip, getting the hip to move forward and that knee drive. And you'll start to get, if you have any weakness, you'll start to get some cramping in that hip flexor.
Yeah, love that. That's also a good, like you make a good point of how we're challenging, like in what ranges we're challenging the hip flexor. This is where like the FRC world comes to mind, like putting an athlete all the way at their end range, getting them to do like some type of lift off so that they can control that muscle all the way in a max shortened cycle as well as with it elongated. So I think that those are a lot of awesome tools. And just to like give the audience an example, patients coming back from ACL reconstruction, now you're headed back towards sprint mechanics, and they're just not getting the same amount of speed or force. It could be because of some of these deficits. So you're giving us a ton of tools to try. First of all, now we know what normal should look like. Second of all, how do we approach normal? How do we help these athletes get back to normal? These are great tricks to try. You've made mention of how far along, or how you've come along your personal journey with coaching. What are some of the things that you've tried in the past that you thought were kind of tried and true and failed?
Man, so my cup of tea coming up in the college football realm, being a outside linebacker, bang heavy weights. And we do that. That's one of our 4 principles of training is lift heavy. So we lift heavy, sprint fast, jump high, throw hard. That's like all philosophy bundled. And I was such a one-dimensional coach. I told athletes and would try to reiterate, like, man, you're getting stronger, which is going to make you faster, which is going to make you a better athlete. But there was a disconnect there. And yes, we taught compensatory acceleration and all these things that do translate really well. But me not swallowing my ego and educating myself for many years allowed me to shortchange athletes. Because I truly believe that if you're not doing some type of sprint training with an athlete, you're not giving them their full potential or trying to get them there, especially in our team sports. Like, we have to be sufficient. And what I've found is many sport coaches, strength coaches, and alike all truly believe in their heart that every kid should just know how to sprint. We just expect a kid to know how to sprint. And it's the furthest thing from the truth. So that was the biggest deficiency for me, man. Like, on my journey, I had this disconnect of, I'm teaching you strength and that's going to translate. And sure, we had some great results. We've been busy for 8 years. But it's just the results now that we have 5x'd of what we've had prior. So last year, just for example, we had 19 seniors graduate out of our program. All 19 received college scholarships. 18 of them are currently playing. The 19th one, he just wanted to go to school. He didn't want to wrestle. So I've never had that before. And the only thing that changed was me swallowing my ego and attaching sprinting to my game.
Okay, so you started what? You started doing all of the sprint mechanics and assessment that you described at the beginning of this conversation. You started like putting that in programming?
Yes, putting that in programming and actually being affiliated with a group that is 10 times better than I am when it comes to the sprint side. So our gym is what's called a speed lab gym. So universal speed rating is Les Spellman and crew. I'm actually personally invested in the company as well. And it is a software company that allows us to rank, record, publish, and have data that is doable and easy for the kids to know what they're looking at. And that's where we came up with those 4 pillars: max speed, acceleration, power, and change of direction. So those kids can now know, this is what I'm good at. Here's my deficiencies. How do we move forward? And that was the biggest tipping point for me, is every time we sprint, it should be tracked. Instead of, hey, we're going to run 10-yard sprints today, just go run 10-yard sprints. Hey, the second one looked faster than the third one. That was me for 5 to 7 years.
Yeah. And I think that's a rut that a lot of people fall into. I got a chance to learn from Les at Sportsmith. He obviously is at the cutting edge of this stuff. So I think it's an amazing program to include. How do they make it so easy? Like, give me an example of what is so easy about his programming and that program that you're a part of for the user. Like, what makes it so easy for the kids?
It's twofold. The software, number one, we'll get into that. But number 2 is the simplistic approach to training speed. We break speed down in 3 categories: max speed, acceleration, and change of direction. Now, your plyometrics can fit into change of direction. There's all that when you really want to get into it. But if we can simply just have kids work on the mechanics and the angles of acceleration, the mechanics and the angles of max velocity, and changing directions, absorbing and re-accelerating force, that in itself, just from a simplistic approach, like, it doesn't really, I mean, it matters, but you just need them to go through that stimulus and the body will take care of the rest. On the software side, they've made it And honestly, I really give them props. They've taken feedback from guys like us, speed lab directors, and said, hey, this is what we need, and this is what's going to help the athlete. And they've made those changes on the go at breakneck speed. So the biggest thing is I can send you a report sometime, but we have our speed labs report. So we have historical data, and we have the speed labs report, and it will allow us to compare them to people in our gym, our city, our state, and the world. And it really puts things in perspective for those kids. Like, hey, I think I'm a D1 running back. Well, we beg to differ.
I love that. I mean, it's all about comparing them to norms. That's one of the things that I've really valued about us dabbling into the force plate world, and that's a whole different conversation. But I've been using Vald, and then we just moved over to, we've been using Milok, I think it's called.
Okay.
And just like the ability to standardize not just your athletes, but how do your athletes compare to other athletes? How does an outside linebacker compare to a Division I outside linebacker, to a professional outside linebacker? All these things, like, you're really able to segment all of these different athletes' outputs and standardize and normalize, right? So you know what you're shooting for. So I love that Speed Labs is there as well. Talk to me about how you think about the difference between acceleration and max velocity.
Yes. From a 10,000 foot view, it's just angles. How I look at it. So when we're in an accelerative state, we're trying to find as many acceleration steps as we can, and you're going to be plus or minus a 45-degree angle. Okay. Now, what you'll see a lot of times is kids dropping their head, their trunk falling over their toes, and they just reach with their front feet, right? That's where they're like, hey, I'm bent over, but we need that spring action. We need that 45 shooting out. That's the big thing. It's going to change our shin angle. It's going to change our hip angle, our knee angles, and our knee flexion and our hip flexion. Then when we get to max velocity, this is the teaching of principles of getting vertical. Once we reach that max velocity, let's just take a 100-meter dash, for example. Here, we're right nice and tilted up, as by the time we get to 50, 55, we're straight vertical. We're looking at really driving our knee and hip flexion and making sure that that foot snaps underneath us. And the biggest thing is ankle stiffness. You'll see in both accelerative and max velocity, if ankle stiffness gives, one, it puts us in the perfect position for Achilles ruptures, where and the ankle stiffness in the max velocity is we just have to be able to hold that arch. I always talk about putting a credit card underneath the heel. That's where we want to be.
Yeah, it's really interesting. Like, I think, I mean, I'm showing my age, but I think about how upright Michael Johnson got towards the end of his sprints, right? Like, the guy's almost bending backwards. And so, like, your mechanics are so different at max velocity versus acceleration. I think you do a good job of describing where that body lean should be and then where that the foot strike should be.
You'll see a big thing on, we have a shred mill, and our shred mill, it gives us a graph as they go. And when we're doing acceleration into max velocity, you'll see it with athletes. You'll see that they will dip as soon as they get from quad dominant pushing mechanics, and then they transition to getting vertical. You'll see a dip in force, a dip in production, and a dip in speed, and then they go. So then it's like, hey, you have a deficiency in max velocity. That's what we need to fix. It's super.
Yeah. Love that. Love that. Okay. So, I mean, you've done a lot of describing of track athletes and sprint mechanics with track athletes, or at least it sounds very track based. What happens when things get chaotic? You go on a football field, you're dodging defenders. How do you teach athletes to apply clean sprint mechanics in the chaotic team sport environment?
Yeah, I love that. So the change of direction and the plyometrics are king when it comes to that. That's how I look at it. Now, I went to the Speed Lab Summit last year, and I learned from Tony Villani. Tony Villani absolutely blew my mind when he talked about this. So I always knew it, but I never conceptualized it. So he coined the term game speed. And so Tony Haller, he's like, hey, max velocity, just make sure, because that's all he was teaching is linear track. Mm-hmm. But Tony Villani, he said, we need to establish game speed. And he said, with GPS data, NFL athletes almost never go over 80% of their max speed. So what he said is, we need to raise our threshold as high as possible, but we need our 80% better than everybody else's 100%. Because then if you try to hit a cut, if Tyreek Hill tries to hit a cut at 100% max velocity, the multiplication of forces that he has to go through to reduce and reproduce speed and force is astronomical. But if we're at 80% and we can stop on a dime, instead of having a 3-cut sprint, we have a 2-cut sprint. That's what makes Tyreek Hill Tyreek Hill. You know, like that freaking blew my mind, man. And it's just that's what we're really trying to do. So reacting to variables that are novel on the field and being able to produce 80% of force better than 100% of everybody else.
Okay, so that makes a lot of sense. I remember him showing video of him running a cut versus NFL athletes running a cut, right? And NFL athletes like spinning out who hadn't learned how to control at like 80%, like you're describing, and him making a beautiful cut. Meanwhile, he's a 50-year-old dude. They're at the prime of their athletic career, and it's so his answer to that is, let's increase that overall max speed so that 80%, like you said, is higher than others 100%. So that makes a lot of sense. What kind of drills do you do to teach that other than increasing their max velocity?
Yep. So kind of back to the plyometrics and that kind of stuff. Reactivity is a big thing that we try to focus on, is making sure that they can react to a stimulus that is not a closed loop exercise, right? Like we want an open loop exercise, whether they're doing stop and go drills or competition against each other, shadow drills on a 5-10-5, right? Where we have to compete against something and somebody else, where it's not just go from point A to point B. And then we break our plyos down in a 3-dimensional, in a 3-tiered system: vertical, horizontal, and rotational of some sort. That's been big for that side of things too. But again, as far as like specific drills for raising that threshold, we're just trying to focus on track mechanics, because the fastest people in the world are track, and then we just have them apply it to their sport. That's
okay. That makes a lot of sense. Last piece on the clinical side, since we're dealing with so many athletes coming out of injury in the PT world, how do you train speed in athletes returning from injury? How different is that, especially when confidence or explosiveness is lacking?
Very, dude. It's huge. I'm dealing with one right now. I've posted stuff on her, so she's good with me talking about it. But Macy Mo, and she's a great pole vaulter, high school athlete, phenomenal kid inside and out. And she had a tragic ACL tear. She came down in the pit, slid in the pit, and just destroyed her knee. So what we're working on right now, she's still going through PT. She just has got authorized to do upper body, trunk, that kind of stuff. Well, we have this leg press here. This is Treadmetrics leg press. So what they found is they can mimic the exact data. This is crazy. They can mimic the exact data of a force plate with electrical impulses, meaning how much force that I produce, it pulls electricity out of those little slots there and matches my force. And I can do overloaded eccentrics, jumping, ISOs, and all that. So all that whole story, to bring it to you, is the first thing that we really accomplish with a kid that is coming off ACL is I want to see true, really good isometric strength in 3 different positions, right? I want to make sure that they have very close to 90, extended out, and we have 3 pre-programmed positions in there. Once we have that isometric strength, I feel a lot more confident on doing things outside of that. So once they've entered that return to play protocol, the shred mill is honestly their best friend. And the reason is it's a controlled environment. They don't have to worry about varying surfaces, anything like that. Once they can graduate from gear 2, gear 3, gear 4 on the shred mill, then we'll start opening them up with leveling intensities. That's the big thing on my end. It's just make sure letting pain be our guide. We're going to start at 50%. We will not go more than 50% until you have the motor unit recruitment and control that you feel comfortable to move to 7.5. That's
super cool. Yeah, I love that. I love how objective that is, and that they can see a progression. That's really cool. So thanks for sharing that. Okay, let's shift gears just a little bit. I want to talk about peptides, recovery, and supplementation. Okay, here we go.
Let's do it.
Okay, you've mentioned peptides on your platform. Which ones have you used personally? What were the effects you've seen? And but as it applies to both peptides and supplements, what do you recommend as a collegiate athlete that may be bound by different rules than, say, me and you?
Exactly. And that's this fine line to ride on, right? Like, I have a very unpopular opinion that may make other individuals, not you, but upset, that there's a reason why the FDA has put a kibosh on these peptides. It's because it takes money out of the pharmaceutical industry's pockets. They're so effective, dude. I mean, my backstory, I've had 3 shoulder surgeries, all labrum rotator cuff. I had ruptured my patellar tendon, and I also had a meniscus surgery on the other side. Every joint has had a needle in it, and having said that, I'm still able to sprint 21 miles an hour and do these things due to the peptides. The big thing that has revolutionized my life, honestly, and I truly believe I'll be phasing in and off of it for a very long time, is the combination or the singular BPC 157 and TB 500. From my understanding and my research, they have a very good duo of both looking at cartilage, ligaments, tendons, muscle, and inflammation, and really, really getting those things under control. So, man, it's tough. Like at the NAI level, unless it's like IGF-1 or some of these that really raise your performance levels, they don't test for BPC or anything like that, right? Once you get into the D1s, I think there is some regulation on that. But as far as like the thing that's really changed my life, Yoni, is BPC 157. That's revolutionized.
And it's just your ability to recover from workouts. And by the way, like NFL, I think 2 years ago outlawed BPC. I think you're right. I think a lot of that has to do with FDA and the money at play there. But tell me what BPC has done for you.
Oh man. So over the years, I have patella alta. I've had that my whole life, and it just wore down my cartilage. It completely wore down my cartilage. And I did stem cell treatments. First started with PRP, which thought that it worked. It really didn't. Stem cells. And then I've been phasing on and off of BPC 157. The biggest thing is the inflammation factor. BPC gets rid of inflammation that you didn't know you had. That's a big thing for me. And then just because of how the Western medicine world works, I can't just get preemptive pre and post MRIs to prove this. But with my feeling and how I perform, I know for 100% fact, as much as I can, that it has helped regenerate, very small, but regenerate some of the tissue loss, the cartilage loss that I've had in knees. And it's amazing, man. That's the big thing for me, is the inflammation and the ability to continue training athletically, obviously in a different manner than when I was in my 20s.
Yeah, I mean, and for those competing, or for those who have patients that are competing at levels where they're testing for this stuff, what's a go-between? What do you recommend to have a similar effect, if anything?
Man, it's so hard. I mean, your traditional, your glucosamine, chondroitin, your that kind of stuff that can help. When I was playing college ball, I can't bastardize it by any means because I used it all the time, but NSAIDs I used all the time too, and it actually caused health issues down the road with livers and kidneys and stuff. But there's just nothing like it. The way I put it is when you take your fish oil every morning, right? You take your fish oil, you're not like, holy crap, I feel that fish oil. But you use that sub-Q BPC, you feel it, like you know it. It's like drinking Element. Like when you're fully hydrated, you can feel it. And that's why it's so profound for me.
Okay, anything else in the supplement world? Like, are you a creatine guy? Anything else that are non-negotiables for you?
Yes. Creatine, non-negotiable for everybody. Some of the research for bigger guys now is looking at the 10 grams for the neurocognitive, the depression, anxiety, that kind of stuff, and upregulate.
It's really, it's really interesting. Like 20 plus years ago, when I was a college senior, I wrote my dissertation on creatine supplementation. Only reason I knew about it was because of Mark McGuire, because he was like the first dude who was like using creatine, or at least it was super public about it. The research around it is unbelievable. It always shocked me that the dosage was not commensurate with how big the athlete was. Like first of all, we used to talk about loading, like a loading phase of it, and that's kind of been debunked. But then it always capped out at this 5 grams, seemingly for no reason. So it's interesting to hear you now talking about it. It makes a lot more sense. A bigger dude should need more creatine.
Yeah, and you're right. It's just maybe it's something that they just didn't think about. But when you look at everything else in this supplement world or dosaging world, usually it follows those parameters, like especially if you've been taking it for a long time. So they've shown if you're taking it 2, 3, 4, 5 years, like we need to up that threshold. As you gain muscle, you need more creatine requirements, So like it's interesting to see. But I said this a couple years ago, and it wasn't an original thought, but I had somebody say it and I heard it and I loved it. He said, within 3 to 5 years, creatine is going to be the new multivitamin. And it's so
true.
It
really is.
It's so true. I mean, bone mineral density for older populations, holding muscle mass, the neurocognitive of raising brain-derived neurotropic factors, like it is a non-negotiable. And then the only other big non-negotiable that I have is getting 1 gram per pound of body weight in protein. So however you got to supplement that, and some type of vitamin D. Because if we look at the whole population, 90% of people, it's actually like 80% of people are deficient.
Even in North Dakota?
Oh, buddy, those winter storms, man.
Okay, so it's creatine for you, it's vitamin D, and it's 1 gram of protein per body weight.
100%. Yep.
Okay, and by the way, I think it's worth noting that we don't talk enough about nutrition when coming back from injury, and athletes that it doesn't just have to be the 16-year-old girl who has trouble putting on muscle mass. It's really anyone coming out of, let's say, an ACL surgery that needs quad mass. And we're sitting here like dumbasses wondering, why can't this kid put on quad? A lot of times they're just not getting enough fuel to create that growth, and how important those last pieces are: the creatine, the protein, and the vitamin D. We know that vitamin D is also linked to pain levels, so it's worth having an understanding. And then just talk to me about ways to measure that. Before we started recording, we were talking about function health, and then we were talking about some of the blood panels that you use, how important that is. Tell me like what the best way to go about those is.
Man, depending, like, I think my biggest deficiency was I never struggled with nutrition. So I projected that onto my athletes, and that's far from the truth. And when I actually have an athlete inquire to me saying, hey, I need help with this nutrition, the training just makes the training look so much better when the kids just really lock in on that. As far as measuring, like, let's just say protein, we will do, as long as the athlete is comfortable with it, we're going to have them do body weight measurements. If we're on track, that's my data set. Right? We can track calories and do all that, but it does get meticulous. As far as vitamin D level, I just track it off of blood work usually. Some athletes, I do have some athletes that do blood work, but mostly it's my adult population that does it. And I don't remember the last time that an adult that hadn't worked with me was sufficient in vitamin D. I honestly don't. And like you said, it's linked to pain, but it's also linked to our hormones on what we can produce. So it's the magic bullet if you had one,
Yeah, I think that's a great point, and I think all sports PTs really need to take that in, educate themselves so that we can educate the patient in front of us. So I appreciate it, Colby. Man, so you've taught me a ton. You really simplified sprint mechanics. I loved how objective you're being about it at Origin Performance. It sounds like you're up to awesome stuff. Tell everyone how they can find you, because hopefully you just gained a bunch of sports PTs following you.
I appreciate it, man. So you can find us at Origin Performance. So actually, as of January 2025, I sold my old business. Lack of alignment in where we wanted to go. I wanted to go all in on athletes, and they wanted to go do their thing. So we actually just started fresh, right? Like I've owned a gym for 8 years now. And Origin just started January 1 of this year. So you can follow us on Origin Performance. And you can also follow me for speed stuff, but also the blood work, the lifestyle stuff at Coach Wartman is where we find a lot of that.
I love it. Colby, you've been a wealth of knowledge. Thanks for teaching me. Thanks for teaching our audience. I look forward to staying in regular touch. Everyone listening, go follow this guy. He's a wealth of knowledge. I've appreciated my time with him today. Also, just leading up to the episode. So check him out. For now, let us know what you loved. Let us know what you hated. Let us know how we can get better We're True Sports PT on Instagram. Thanks for listening. Bye-bye. Bye-bye.